Hello, I'm Dr. E. Barry Gordon, and this is the 21st video in my series on testosterone deficiency, the hidden disease. The disease that ultimately affects all of us. The disease that plays a major role in making us old. The disease that will, in all likelihood, contribute significantly to our deaths. Today's topic is vascular disease in men. The term vascular disease literally means any of the many and varied diseases that can affect arteries or veins. As it is currently commonly used, however, vascular disease refers to arteries becoming clogged with cholesterol plaques. Although almost any artery can become blocked with cholesterol, the three most common types of vascular disease are peripheral vascular disease, usually meaning leg arteries and the carotid arteries in the neck, cardiovascular disease, the coronary arteries, and cerebrovascular disease, the arteries in the brain. Clogged arteries in one place generally mean clogged arteries elsewhere, so there is every reason to believe that if testosterone deficiency predisposes to any vascular disease, it would predispose to all. Is there any research support for the idea that the lack of testosterone promotes vascular disease? It's abundant. Between the videos on diabetes, this video, and the next one on vascular disease in women, we're having a look at over 12 published medical studies, all showing a close relationship between testosterone deficiency and vascular disease. I discussed 9 of them in the last video on diabetes. If you'll recall, the association of diabetes, the metabolic syndrome, and cardiovascular disease is so strong that many physicians assume that anyone with diabetes and the metabolic syndrome also has cardiovascular disease. One of those studies specifically stated that patients with testosterone deficiency have a higher risk of cardiovascular disease, and another specifically stated that patients who have their testosterone replaced have a lower risk of cardiovascular disease. Today I'm going to quote from 4 more medical studies done on men, all reporting a connection between testosterone deficiency and cardiovascular disease. I'll discuss another 5 studies that were done on women in the next video. As I've done in previous videos, I'm going to substitute simpler words or phrases for technical terms so you'll understand more clearly what these researchers are saying. The unaltered abstracts are on my website, www.thehiddendisease.com. You'll also find there many dozens of published medical studies from leading research institutions, all the previously released videos in this series, and dozens of videos of interviews I've conducted with my patients. Before getting to today's 4 studies, however, I'm going to quote from another one that specifically refuted the opposite concept. It's a fairly popular medical myth that testosterone itself can be a cause of cardiovascular disease. Many doctors use it as an excuse to avoid dealing with testosterone deficiency. This study on that issue was done in Columbia University and was published in the December 2005 issue of the American Journal of Cardiology. Quote, "There is no contraindication for testosterone therapy in men with cardiovascular disease and diagnosed testosterone deficiency, with or without erectile dysfunction." Now, the following 4 studies found a causative relationship between testosterone deficiency and developing cardiovascular disease. In 2004, an English study was published in the journal Heart. They wrote in the body of the abstract, quote, "Low serum testosterone is associated with several cardiovascular risk factors including cholesterol and triglyceride abnormalities, adverse clotting profiles, obesity, and insulin resistance." Close quote. Insulin resistance, remember, is considered to be a mechanism of type 2 diabetes. Before I quote their conclusion, I have to explain the word ischemia. Ischemia simply means an insufficient supply of blood. There is enough blood flow to keep whatever tissue is being supplied alive, but not healthy. when it comes to the heart, ischemia is most commonly detectable when a person is physically active and the heart needs more blood. It can show itself as chest pain, called angina, or can be detected when it causes an abnormal stress test. Now the study's conclusion. Quote, testosterone replacement therapy in testosterone-deficient men delays time to ischemia, improves mood, and is associated with potentially beneficial reductions of total cholesterol. In other words, testosterone replacement enabled these men to do more before the blood supply to their heart became a problem. I have a woman patient who had stable and predictable angina, heart pain, for many, many years. Some months after starting testosterone replacement, it just disappeared. A study out of Rome, Italy, published in August 2006, concluded, quote, patients with coronary artery disease have lower testosterone levels than healthy controls. These changes are inversely correlated to the degree of coronary artery disease, suggesting that low plasma testosterone may be involved with the increased risk of coronary artery disease in men. This study was done in Ankara, Turkey, and was published in the May 2007 issue of the journal Coronary Artery Disease. Their conclusion, quote, a low level of free testosterone may be related to the development of premature coronary artery disease, close quote. Mount Sinai Hospital in New York came out with a study in June 2007. It had an interesting title, Why Men's Heart Break, Cardiovascular Effects of Sex Steroids. I'll quote from their abstract. Quote, recent cross-sectional studies associate low testosterone with a greater incidence of coronary artery disease in men. Testosterone has demonstrated effects on diabetes, obesity, clotting, and inflammation. Imbalance of sex steroids contributes to adverse cardiac effects in men. We have England, Italy, Turkey, and several major research institutions in the United States, all repeatedly finding that testosterone deficiency leads to clogged arteries. How many studies have to be done before the medical establishment wakes up and gives the disease of testosterone deficiency the attention it deserves? How many more millions have to become sick, disabled, and die from a disease that is so simply, safely, and cheaply treated? Once again, please go to my website, watch the videos, look at the medical studies. If you become educated about the hormone and the disease, you'll recognize testosterone nonsense when it's thrown at you, even by doctors. I'm Dr. E. Barry Gordon. Thank you for watching.